Of a 26-year gentleman. He's a known case of spina bifida, and he's doing self-catheterization. He has history of some surgery in the childhood and now developed visible hematuria. Okay, can you just quickly tell me what are the information you want to know from this gentleman?
I would like to see this patient in a general urology clinic, make sure that the room can occupy spinal bifida if he's using any wheelchair, ideally pre-assessed with the urine dipstick, maybe blood pressure as well. I want to know if he noticed any difficulty with the self-catheterization, what size of self-catheterization is he using, if he's developing any infections recently or getting admitted to the hospital with infections. And I would like to know if any record of the previous surgery that he had in the bladder, either augmentation and at what age. If it's more than 15 years ago, or you said some 10 years ago, then there is a possibility he might have a bladder tumor. I would like to check if there is any symptoms of advanced disease, and if obviously there is risk factors here, but I would like to know if there is any high blood pressure, symptoms of renal failure, or if he's taking any medications or blood thinners, medical history, surgical history. And then I would proceed to examine the patient in the presence of chaperone, looking for if he had any stomas catheterizing through or through the urethra. Want to know if he had any palpable kidneys or bladder, any tenderness, and would see his urine dipstick and go
Right.
for at least PVR after SIC to know if the bladder is emptying. I would like to consider doing an ultrasound to the upper tract and doing a cystoscopy for him.
Okay. Right. So you find that he had a surgery 10 years back. You don't find any records of the surgery. You just find there's a midline scar in the abdomen, having a weakness in the lower limb, and he's doing his self-catheterization because his upper limb function is all right. Okay. He did not have any history of blood thinners or any traumatic catheterization, no history of UTI. Any other information you want?
Um,
So the renal function, you got the renal function, the creat is normal.
okay, creatinine is normal. It's always normal in spina bifida patients. Then I would like to proceed doing PVR after SIC and an ultrasound to the upper tract and a cystoscopy as well.
Right. So you got a cystoscopy done, and also the PVR is not significant, okay, because he's doing a CIC completely. And you got a cystoscopy, and cystoscopy shows there is a lot of pus flakes, and you find there is a tumor in the bladder.
Okay. Okay. So
Any other information you want to know from the cystoscopy?
yeah, I want to know to see probably he had a bladder augmentation. I want to look at the pouch. I mean the augment, if the tumor is at the augment site or at the bladder. Want to see his ureters, if he had I want to see if his ureteric reimplantation, the orifices, or he's using his native ureters. We want to see the bladder neck and the urethra.
Perfect. So you find there is an intestinal segment, easily the mucosa of the intestinal segment, and the tumor seems to be rising from the junction of the intestinal and the bladder anastomose. So it's of around 3 to 4 centimeter tumor.
Okay. Okay. So,
Please stand done for the same.
okay. All right. So I described this CT. So this is an axial and a horizontal view of a CT abdomen with contrast. The most striking abnormality is enhancing bladder mass, probably, as you said, at the junction of the bladder and the bowel. So it's most anteriorly. I would like to review the rest of the images with the uroradiologist to check if there is any lymph nodes, and I want to know if there is any metastasis to other organs. I want
No,
to discuss this.
there is no metastasis. It's confined to the bladder. You also find that the left kidney is atrophic.
Okay, traffic left kidney. Okay, so I would like to discuss this patient in the MDT. considering all these information, young gentleman with bladder tumor,
So the MD
localized.
wants to know what could be the possibility. What do you think is the tumor?
I think it's could be an adenocarcinoma or a squamous cell carcinoma. You need to biopsy to
So why
confirm.
why why an adeno or why a squamous?